Good evening. We are starting now with the school town hall meeting. And we want to welcome everyone here. Also those that are on Facebook Live streaming this. Thank you guys for joining us this evening. And it's my honor and privilege again to be your moderator this evening. My name is Pax Harvey. So we will go ahead and start first and foremost with our opening prayer before we continue. So the opening prayer is going to be rendered by Sasha Nels.
Thank you, Pax. Let's pray. Dear God, thank you for this time again that we have come together to meet as leaders and that we have come together to give some information to our parents and families and continue to pray for safety, for strength in this time, for hope, and to be encouraged no matter what trials we're facing at this time. We thank you for the many blessings. We thank you for your continued guidance and help in this time. And Lord, be with us tonight. In Jesus' name I pray. Amen.
Thank you, Sasha, for that beautiful prayer. So with that, ladies and gentlemen, we're going to go ahead and start with our agenda this evening. And as we all know and are aware of, that COVID-19 is still around and we still need to continue to protect ourselves. So we're going to share some information with you all here this evening again by the professionals in our area. So we're going to start off first with the Winslow service area. COVID-19 data presentation is going to be given by WIHCC and Sasha Nels, who is the school health task force leader.
My name is WIHCC, and I'm here to provide the Winslow Indian Healthcare Center COVID-19 situational report. And this is updated through Tuesday, March 2nd, 11:59 p.m. Total number of tests performed is 22,374. Total number of negative tests is 18,905. Total number positive tests is 2,784. And our 14-day positivity rate is 8%. And that has gone down a lot. I believe last week was 13%. And just a quick update as far as vaccinations. Mass vaccination clinics will be held March 6th here at Winslow Indian Healthcare Center and March 13th again here at Winslow Indian Healthcare Center, focusing on number 2 dose of Moderna. And other community drive-through COVID-19 vaccination dates are on the right-hand side, which include March 9th, March 11th, March 23rd, March 25th, and March 30th. And all those locations will be within Winslow service area. And appointment only, you would have to call the 289-1930 phone number to schedule that appointment. And as far as vaccinations administered, we have a total of 7,600 vaccinations administered.
Thank you, Alicia, for that valuable information. We appreciate that. And thank you for all the hard work that you do. So we're going to turn the time over now to Sasha Nels.
Good evening. So I'm presenting the data by Denise Blackrock, our Director of Public Health Nursing. Here is our current slides for the number of cases by community. We have our 8 communities here, and as you can see, a lot of the lines are trending in a plateau type of trend where there's not a lot of increases in our communities, so that's a good thing. We do have a slight continued increase in the loop area, if you can tell, but otherwise everywhere else has gone in a plateau level. And then here is our border town. We have Joseph City continuing to show in the lowest rates of positive COVID, and Holbrook is in a plateau trend, and Winslow is still in an increase, but very slight increase. It's starting to plateau. And here is the data from our 8 cases by age groups. We still see that the 25 to 34-year-olds have the highest rate, and the 15 to 24-year-olds and the 35 to 44-year-olds are about equal as far as the number of positive cases in those age groups. When we look at pediatric cases only, we see that thus far we've had a total of 517 pediatric COVID-19 cases, and the highest rate continues to be the 15 to 17-year-olds. And when we look at the nature of the increases of these cases by age group, if you look here, you can see that the younger age group numbers have plateaued. You see a slight increase in the 3 to 5-year-olds, really slight, more of a plateau with the 6 to 8-year-olds, and the 9 to 11-year-olds also have leveled off. Looks like the 12 to 14-year-olds are leveling off. When we look at the 15 to 17-year-olds, there's still an increase in that age group. Here is a picture of the data from almost a year ago, and you see the first wave, and you see how we went through the second wave, and where we're at as of February 27th. We continue to see a low number of daily positive cases. That's a good thing, and our hope is that it continues to stay in that trend.
Thank you, Sasha. Again, thank you, Alicia, for those valuable information. And those of you that are out there watching again, listening and tuning in with us, we appreciate you. And I know, again, a lot of you guys have been participating with us. We do appreciate you. Thank you for your questions. And also, again, just a reminder, you can actually go to the school health at WIHCC.org that's our website, or actually email. You can go there to ask questions or suggestions or recommendations or comments. And then you can also go to the survey, which is in the chat box. Make sure you go there and give us feedback. We do appreciate your feedback. So now we're going to go into the Navajo Nation COVID data. And again, that's going to be given by Sasha.
Okay, thank you again. So this is information that we have pulled from the Navajo Nation Department of Health dashboard. And right now, this gives us the total number of cases by all the different service areas on Navajo Nation. And you can see on the very far right is Winslow, 1,930. When we look at the trend and the waves, we can see that we have seen a great decline in the cases on Navajo Nation as of March 1st, 2021. And here, it's kind of hard to see this, but Winslow is the brown line. So again, this coincides with our local data as far as what we're seeing from Winslow Indian Healthcare Center's data, but this is the Navajo Nation, the communities on Navajo Nation in our Winslow service area. So we see a trend of a plateau phase. So that is a good thing. And it looks like all the other service areas are similar. And this is the COVID data by age groups from Navajo Nation. And we see that the highest age group are the 30 to 39-year-olds, followed by the 20 to 29-year-olds. And then when we look at the border town by age group, again, the highest number of COVID cases is among the 20 to 29-year-olds and the 30 to 39-year-olds.
Thank you, Sasha. And also we want to thank the Navajo Nation for sharing their data with us. It's very important. And as you guys can see, looking at the data, it's obviously well out there still, COVID-19. And we want to go ahead and turn some time over now to one of my favorite presenters. This guy is cool, from Coconino County. This is Matt Maurer. I like saying his last name. That's why I like this guy. Go ahead, Matt. It's all yours.
Yeah, thank you so much for that great introduction. Here you're seeing a picture of our entire epi curve for Coconino County. Currently, we're at a total of 16,454 cases of COVID-19. We're at 293 total deaths. That's 2% case fatality rate that we've seen. among cases of COVID-19 have been reported to us, and 1,202 hospitalizations, which is 7% of our total cases. Taking a look at what you can see on the screen, I hope you can see my screen okay?
Yes, we can. Thank you.
Great. We're seeing good trends along with all areas that have been discussed, Navajo Nation as a whole. Coconino County, most recent complete week at 216 cases. A little bit of a plateau here compared to this very large drop that we saw from about the middle of January and decreasing now into February. So a little bit of evening out as far as our total number of cases go. Taking a look jurisdictionally here, a little bit confusing with all the numbers on this graph and everything, but this green line, these are communities within Coconino County, and you can see what a nice decrease we've seen recently as far as cases. So very good trends. Hopeful that these trends will continue in the coming weeks. I'm going to go ahead and pull up information here surrounding where we're at. So regarding the state benchmarks, we're still in a substantial level of community transmission. As you can see, we still have even though we have a decrease, we still have a very high number of cases, as well as a case rate that's above 100 per 100,000. The most recent week was right around 150 per 100,000. But our other two benchmarks have gone to into the moderate level, so percent positivity hanging right around 8%, and COVID-like illness at 5.2%, really knocking on the door of that minimal level in that transmission. Here's a little bit more detailed look at the epi curve just from October, so we can see that decrease that we've had recently. Let me go ahead and take a look, show you real quick. Age groups, we've seen decreases amongst all age groups. 20 to 44 still continues to be our highest amount of cases as far as ages go. And then this is Flagstaff. We've seen decrease in Flagstaff, but taking a little bit more detail, this brown line is our tribal communities as well. Seeing that decrease, as well as decreases in all other areas, Flagstaff and other cities within Coconino County. Page, however, did see an increase, the only community to see an increase as far as numbers go that ended on 220. We're putting together the data right now from last week, but our most recent data showed a slight increase related to Page. So trending in the right direction. As we take a look at some of the school information, ADHS did just recently change all of their benchmarks as of today. Today being 3.3, so I guess you could edit that out if you're going to show this later on. But as of March 3rd, ADHS did change how they're displaying their school benchmarks. So we will be changing to update and be consistent with what they're showing. But you can see some of the different school districts to the city here still having a rate of that's in a substantial area, as well as a percent positivity that's substantial. Lots of other school districts seeing the same thing, but some of our individual school districts have seen a nice decrease in cases. The cases by geographic region, and this is our incident and then positivity yield. But what I want to show you is looking at a little more detailed age breakdown to see specifically for schools, our 0 to 17-year-old age group, and quite the decrease we've seen in that age group regarding cases. Most of our cases being within the 18 to 24-year-old age group. So good trends there as well. Real quick for Coconino County, I'll just show you some of the vaccination information that the state website has out. And so as you can see on my screen here, as I click on Coconino County, total doses administered are at 55,250. This is as of March 3rd, and total number of those vaccinated are at 15,472. We, on our weekly update, we have added a vaccination page that breaks down our communities a little bit better here. And so this graph, you can see the vaccination by race. 24% of those vaccinated Native American, 30%, 37% white. Most of those that are vaccinated are unknown altogether, 4% Hispanic, and then a gender breakdown as well, and an age breakdown. But then taking a look at this table down on the bottom and really drawing attention to this last column of fully vaccinated per 100,000. So that's our rate. And so Flagstaff as a whole is at 7,565 per 100,000. Page is at 8,520. The highest rate of those vaccinated are communities at 11,222 per 100,000. So very good work that is taking place on Navajo Nation and other surrounding areas as far as getting the vaccination out. It's some amazing work, and really want to recognize all of you that are on this call today, and all the help that everybody's providing for that and all the assistance. So that's the update I have for you today.
Hey, Matt, thank you so much for that awesome information. Great information. Thank you for all you do out in that area in the Coconino County and for our people as well. And we do want to just wish you guys the best. Be safe, be careful out there, Matt. And so we'll see you at the next town hall. Take care. Have a good evening. And next we have Janelle Lynn from the Navajo County. She's the Navajo County Director. She'll be sharing some data with us as well. So Janelle, the time is all yours.
So as of today, this is a snapshot of our current non-tribal cases for Navajo County. Non-reservation to date cases worked by our public health nurses is 6,562. Combined cases with the most recent numbers reported to us by our tribal partners is 15,108. We currently are monitoring 92 households who are being isolated and monitored. We only had 5 new cases reported to us in the last 24 hours. Hospitalizations to date are 467. 568 cases in Navajo County off tribal lands have been directly related to schools. And we're also tracking our flu data, and to date, we only have 5 cases of flu reported to us. This is a snapshot of our epi curve from our first cases back early in the outbreak to present, broken down by week. So you can see our trend, our pattern follows that of other jurisdictions across the state. Our primary week where we had the most cases, these are just non-tribal cases that we're tracking here. We had 410 cases reported to us in our peak week, and our second spike dropped much more drastically than our first, and numbers have continued to remain low. The most recent data we have for rates per 100,000 and positivity rates are from February 28th. February 28th, we were at 19 per 100,000. I know this graphic on the right is a little difficult to see, but it gives you an idea of the snapshot of where things were at the peak of our outbreak, where our rates were 457 per 100,000. So that's a significant decline. Our current positivity rate is 2.4% for Navajo County, and that's also a significant decline. Currently, our COVID-like illness as of February 21st, 4.2% for hospital inpatient and 3% for ED visits. We're watching the variant strains closely. This is a current snapshot for the nation of the variant strains. So far, the only strain identified in Arizona continues to be the B117, the United Kingdom strain. And as of today, there are 14 cases in Arizona. None to date have been identified in Navajo County. And it appears that the mRNA vaccines at least continue to show efficacy against these 3 variant strains. Here's a picture of our current vaccine rate in comparison to the state rates. So 11% of Navajo County population has started the vaccine series. 5% have completed, which means we'd still have 84% of our population to be vaccinated. These numbers represent Navajo County as a whole, as accurate as the data that's been reported to us. So as long as our tribal sites are reporting the data into ACES, it is reflected. However, we know not all of the sites are up to date on reporting, so it's a little bit off there. This is our current snapshot from Arizona Department of Health Services on our vaccine. Similar to Coconino County, just continuing to see that steady incline there. We are at 108 or 108.7% of our doses have been utilized due to being able to get extra doses out of vials. So as vaccine is being received, it's being very rapidly pushed out and receiving, getting into a body. We have been really watching to make sure that our minority populations are not underserved, and we are doing well in Navajo County serving those populations. In comparison, we're about at a 50-50 split. So that is information that we're watching and makes us happy. We are to the point we're starting to receive enough vaccine distributions that if this continues over the next week or so, we're looking at opening up our point of dispensing sites. Thus far, for Navajo County off-tribal lands, we have just been utilizing our facility partners and our public health office and giving vaccines through that route due to not receiving large enough allocations to sustain our pod model. However, within the next week or two, we expect to be setting up those pods. We have partnerships with our local fire departments. Those are our pod sites. We've practiced this model with them for years. Every year we do our flu shots on a drive-through trial run to practice for an event such as this. So we have confidence that once we set those up, they're well practiced and should run smoothly. Our pods, this kind of just gives you a map of one of our pods in the put-through model that they can drive through, parking areas that they can have waiting to be assessed afterwards. We really will heavily use this pod model once we are under the tier 2 phase of vaccine distribution. We plan to continue to use appointments for our pods throughout the process, and we have 8 different pod location sites, and then we will activate those depending on our supply of vaccine. That is our update for Navajo County.
Thank you, Janelle, and we also welcome you to our town hall meeting, and congratulations on your position there as well and what you do, and all you guys have been in Navajo County, and all of you there. We appreciate what you guys have been doing for us so far. So thank you for that valuable information. And be safe, be careful out there. We'll see you at the next town hall meeting.
Thank you. We appreciate you too.
Thank you. Now we're going to go on to Dr. Sage White here with Winslow Indian Healthcare Center. She will be presenting COVID-19 update, common question answered. Dr. Sage White will take this presentation. Go ahead, Dr. Sage.
Hi, thanks for letting me answer some of these questions, and I believe they're mostly related to the COVID vaccine. And again, if people, have further questions after I get through these, you can always feel free to, contact your provider here at WIC to answer some specific questions related to your specific situation. But so the first question of, is the COVID vaccine safe? And have there been any severe reactions? So the answer is yes, it is a very safe vaccine. The most common severe reaction, and by most common, it is not very common, is an anaphylactic or allergic reaction. And this can occur, which is why we monitor people for 15 to 30 minutes after they've had the vaccine, because that's the most likely time window when we're going to see those symptoms occur. But again, this is rare. We're not seeing it regularly. There have been no deaths attributed to the vaccines of doses have been given over the last 3.5 months. So yes, the COVID vaccine is safe. If you have specific questions about your, health conditions, please contact your provider. But again, for people with diabetes, hypertension, thyroid disease, all this, it's even more important because you are at higher risk of severe symptoms from COVID. So getting the COVID vaccine is even more important in those cases. So can someone still test positive for COVID-19 after they're fully vaccinated? And the answer is yes. These vaccines, the Pfizer and Moderna vaccines, are 95% effective, which is really amazing, but they're not 100% effective. And so if you're around or exposed to COVID, there's still a slight risk that you can get it and test positive. It lowers your risk significantly of getting COVID if you've been exposed, but so kind of go into one of the other questions, but it's still important to avoid people who are sick, wash hands, use hand sanitizer, social distancing, masks when you're around people who haven't been vaccinated. You don't know what kind of exposures they've had. So the vaccine will not make you test positive for COVID, but yes, you can still get exposed and get it, even though the risk is much, much lower after you've been fully vaccinated, and that's after both doses of vaccines for the Pfizer and Moderna. So yes, we recommend, so in this question, if you've been vaccinated, you develop respiratory symptoms, should you still get tested for COVID? The answer in this current environment with, cases going down, but we're still seeing COVID cases, is yes, you should get tested if you have symptoms. If you've been vaccinated and you get exposed and you don't have symptoms, then no, there's not really a good reason to get tested at that point. But you should monitor yourself if you develop cough, fever, chills, congestion, any of that. The best thing to do is to get tested for COVID to make sure you can rule that out. If that test, and ideally you're getting a send out test, because that is the best test to say for sure you don't have COVID. The rapid test just isn't as good for that. If that's negative, then you can attribute it to a different virus, but you shouldn't just blow it off because you've been vaccinated. So is it safe to bring your kids in for their well child visit? Yes, we are still separating anybody who's sick here at the Winslow Indian Healthcare Center. Healthy people are kind of being seen in the main clinic. Those with respiratory symptoms are being seen through a separate space. Everyone's wearing masks. It's very low risk that your kid is going to get exposed. Also, it's important to keep up on your child's vaccines during this time so that they don't become at risk of getting other childhood illnesses that those routine vaccines prevent against. So yes, please, keep your well child check appointments and make sure your kids are up to date on their vaccines. So the COVID vaccine for children, probably eventually yes. The Pfizer vaccine is approved for teenagers, 16, 17, 18-year-olds. The Moderna vaccine is 18 and over. So currently we don't have any vaccine for younger children. We are getting limited, Pfizer vaccine. And as that comes out, we're trying to, target those 16 and 17-year-olds for that vaccine, since they are eligible for that one. As a reminder, if, even if you are vaccinated but sick, you do need to, quarantine and get tested, as I was saying. And if you're living with someone who's COVID positive, there's different recommendations about quarantine, but currently the Navajo Nation is recommending to do a full quarantine, which is different than the CDC recommendations, but that's related to us having higher case rates. So just as a bonus that wasn't on the slide.
Thank you, Dr. Sage. We appreciate you and thank you for the answers. And that answered a lot of the questions that you guys had out there. Again, your questions are very valuable to us. So again, go to schoolhealth@wic.org. Again, the survey is in the chat box. Make sure you go there, give us information, or you can ask questions there as well. And also the video that this video is being recorded. It will be available and uploaded to WIC YouTube channel and our website as well. So again, we appreciate your questions. We appreciate your input. And thank you again, Dr. Sage. Now we're going to go on to our next presenter. And Luana Benslow is the substance abuse. She's going to be talking about substance abuse, suicide prevention, and her title is Connecting with the Virtual World. So Luana, the time is yours. Go ahead.
Yeah, thank you, everyone. Ja, it's Luan Benzo and she has shown to the Gini versus Chin, Kachini de Chichedo, Hanarani Edishanella, and I'm from Neshduitlana, placed near Hard Rock Chapter. That's where I'm from. I grew up at Ditlandosi near Delcon. I am the project assistant for the Winslow Indian Healthcare Center Youth Suicide and Substance Abuse Prevention Program. Today I want to talk to you about how you can support your child with school during this pandemic. And so right now we're connecting with the virtual world, and that may be new to some of us. So today we're going to talk about the effects socially, emotionally, and mentally, and how to support your child with school during this pandemic. COVID-19 has affected our children in so many different ways, directly and indirectly. Beyond getting sick, many of our children have been affected socially, emotionally, and mentally. This may be a traumatic experience for them. So CDC has stated that trauma faced at this developmental stage can continue to affect them across their lifespan. Some challenges children face during the COVID-19 are changes in their routine. You know, they were in class, now they're learning virtually. So that's a big change for them. It's an adjustment, and they have to learn so many different ways of how they're going to get the content that they're learning. Also, physical distance. We had to inform them that they're not able to get close, limit on hugs, things like that. Also, getting used to wearing a mask. A lot of our kids are really involved with sports. So those are just changes in their routine. And there's so many other things that may have changed in their routine as well. Other challenges, education, the connectivity issues that a lot of schools were facing that we know of, technology, getting to know technology in this way, checking emails, going through a chat, how are they going to communicate with their teachers now? So getting used to that and getting a hang of that. I mean, these are different, things are different now. Learning styles, some kids are, education-wise, they're hands-on. Now, it's a different type of learning. So it may be a little bit longer that they're going to learn the content that the teachers are, trying to teach them. Tutors, there's, having that accessibility to tutors is not, available sometimes, and not at the time that they may need it as well as the one-on-one assistance, where they can ask their teacher like, hey, I need help, and for them to get help at that moment. Health-wise, PE was available for them, being able to go outside and play. Of course, the sports again, a lot of them may be a part of teams, and they're not able to go out there and play, on weekends or city leagues, things like that. They may have missed the well child and immunization visits. Parents may be caught very, cautious and thinking safety for their child, so they haven't taken them. So limited health access. So another part is life events, celebrations, ceremonies, vacations, and trips that may annual trips that you guys might have taken. You haven't gone on one, or you have to be very cautious if you do, and you're missing family that are at a distance, and different milestones that they have missed. I know that last school year, the students that graduated were not able to, do the traditional graduation style. So, but they actually asked the students on how they could handle that. So they came through with that. So those are different changes. Other challenges: lost security and safety at home. A parent may have lost a job, so that affects the house and the food and securities that they may have had before. Increased exposure to violence, online harm, bullying. They're online a lot more, so there may be challenges there. So the quote I had talked about earlier about trauma, a lot of these may be traumatic events for our kids. So CDC has stated trauma faced at this development stage can continue to affect them across their lifespan. So we want to be able to get them through this. We're resilient, so we want to be able to get our kids through these traumatic events, these challenges that they're facing. Another quote that I want to share with everybody is from Sarah Cornelius. She states, "Just because the environment looks different does not mean that relationships are any less central to the learning process for student needs to be successful in their academic journey." So what are these things? What are these successes that we can look at? And we want to look at the different supports as parents, as an older sibling, as an aunt, anybody that lives in the household with these kids, with the students who may be caretakers as well. So ways that you can support your child through this pandemic with school in mind. Help your child build a schedule, have them see it visually. They're visual learners, to be able to see that. Have, always update their planner, maybe look at their planner to see if they have things in there. Set up a designated workspace, providing a school-like environment for them. Maybe it's just something that they know that, okay, this is school time, so they're able to go to their desk or a table where it's clear of other things on it, so they're just focused on their schoolwork. Make sure they have material necessary to complete all assignments. And if not, that communication with your school, let them know if there are materials that you need. Our program, we have communication with the schools, and we're constantly asking them if parents or students are in need of certain items. So we try to assist in that area as well. Familiarize yourself with virtual learning. As parents, we need to know how our kids are connecting, who are their teachers, how are you able to email them, communicate with them, is there a phone, is there a number that you'd be able to connect with them, and understand the resources that are available. I called my son's school and to look into these things, and found out that a lot of the teachers have certain times and days out of the week that he can connect with them, and they meet. Some of them meet by phone call, like appointments, or some of them meet virtually by Zoom. So finding all of those things out, very vital. Build a relationship with your child's teacher. That's very important. That way, if they're falling behind or if they need help in certain areas, that you're able to communicate with your teacher, and they're able to tell you as well, so you know where your child stands. Check your child's messages and emails from their teachers. Find that out, ask questions. Daily check-ins with your child, emotionally, mentally, get updates and reminders for them. Sometimes, especially if you have younger kids, you gotta, constantly ask questions. Learn to identify the barriers and encourage a growth mindset. This will lead to finding their own motivation. It's teaching them to get organized. It's teaching them to motivate themselves and how to motivate themselves. And when they run into challenges, how are you able to get through those challenges? So these are all teaching tools when you help support them. Encourage breaks, like if you see them sitting a lot, encourage those break times. So during the break times, you can tell them to stretch, teach a little few stretches if they're sitting a lot, if they're on the floor, if they're sitting on the floor, and provide healthy snacks for them or prepare those healthy snacks for them. Outside time, have them go outside, go for a walk. That's very important for them to get that. Help keep children healthy by eating healthy, drinking water, plenty of playtime, everyday hygiene, having them get up and wash their face, wash their hands, brush your teeth, all of those things. So help your child stay socially connected. They may miss their friends, they may miss family members. So being able to encourage them to stay connected with them. Reach out to friends and family, either by phone, email, video chat, have them write a card, letters, create things to send to people that they care about. So those are different ways that you could help support your child or your kids through this pandemic and, in this virtual world that has come about for us. So our ultimate goal right here is supporting and recognizing your child's social, emotional, and mental well-being. Having that relationship, that connection with them, constantly asking them questions, where are they at? And that's where the check-ins come in. So so that's what I wanted to share with you guys today. These are my resources that I got my information from. There are a lot of resources out there that you can reach out to. A good one is the CDC, going to the CDC website. And again, I'm with the Winslow Healthcare Center Youth Substance Abuse and Suicide Prevention Program. And WIHCC is the program coordinator, and that's her email there that I'm sharing and her phone number. And again, I'm Luana Benson, the project assistant, and that's my email there and my phone number. So thank you.
Thank you very much, Luana, for that awesome presentation. And all of you that are listening out there, parents and students as well. This is very good information for you all. So if you guys need to contact him, she shared the information with you. So thank you, Luana and Lisha, for all you guys do. We're going to go on now to Nora Baya and Marla Muzzy. They'll be talking about March is a nutrition month. So they'll be talking about nutrition. So go ahead, ladies.
Hello, my name is Marla Mizzi here at Winslow Healthcare Center. I'm a diabetes nutrition technician. So today this month, we are celebrating the National Nutrition Campaign. So this year's campaign for 2021 theme is Personalize Your Plate. So what is the National Nutrition Month about? It's an annual campaign created by the Academy of Nutrition and Dietetics, hosts in the month of March. So this gives an opportunity for people to engage in making healthful food choices, healthful eating goals, and creating physical activity habits. So we just want to bridge nutrition and physical activity because they do incorporate each other. And to both based on that, we also want to encourage individuals to personalize their health plan with their registered dietitian. Okay, and then also on the eatwell.org, you'll find a lot of good materials on this nutrition campaign. So take a look at the eatright.org. It has weekly focus points as well. So, next slide. So these are some of the mentioned weekly focus points that is listed on the website. We want to encourage hydration, practice mindful eating, reading food labels, be menu savvy when you're out dining. There is a category on at certain area restaurants where it states light fare options that are more healthier options, and using a grocery list when shopping. You know, having a meal before you shop is usually ideal, so you won't have to be choosing all food that you don't really need. And try foods and flavors. So this year, me and Nora here has coordinated some activities for our staff here at the Winslow Indian Healthcare Center. We're going to have weekly events, weekly recipes we send out, and tips that are from the dietary guidelines for Americans. And that is also available to download on the dietaryguidelines.gov. So as another tip while we're getting things situated, I also want to share with you that these with the Smith that are going out there is also beneficial when we're online, but you could get susceptible to misinformed information. So also just be mindful that there are federal resources out there where you can debunk health myths. And another good resource is Choose My Plate. In this website, there's also a tab, My Plate Kitchen, which has recipes to help refine your research on your interests of cuisines, food groups, nutrition, or your cooking equipment that you have available in your home. You can also refine those searches on to find a recipe that will best accommodate you. So also recipe videos as well. Those are food demos that are also on the choosemyplate.gov as well.
So good evening, everyone. This is Nora. I just want to share some helpful tidbits with you, with your family. So this is just some tips that we thought that would be helpful for your family. Adults should use non-food rewards. Using food to reward behavior can lead to an unhealthy relationship with food as an adult, such as emotional eating. So instead, you can reward your child with maybe a play date with friends. Of course, you know, encourage them to wear their mask, and try to maybe stay 6 feet apart, maybe in a park, a trip to the park, something like that. Another tip is agree as a family to avoid watching TV during a meal. So our kids, now that they're home, they tend to have a lot more screen time. They tend to be swayed into choosing highly processed foods they see in TV advertisements. So when a child watches TV, they're exposed to anywhere from 10 to 13 different type of TV advertisements that's regarding foods. It's usually unhealthy foods. So instead, eat regular meals as a family without any distractions, no screen time, no cell phone usage, nothing like that. Or spend time learning about new foods with your children, maybe take them grocery shopping, and even let your kids help prepare family meals. So that way they know where their food's coming from, how it's prepared, they appreciate it more. Another tip is avoid feeding your child fried, greasy, rich foods when they are sick. Especially, you know, during the pandemic. It's also flu season. So kids tend to get a lot of colds throughout a year. They get a lot of colds. Instead, alternate between light broth, warm broth or soup, even soft fruits or diluted fruit juices. It helps to maintain their hydration, and then the vitamins and the fruits help support their immunity. And then here is the last slide. This is just questions for all of you. Okay, does stressful time make you react to your environment? Okay, most of us, believe it or not, are just reacting to situations in our lives. That's always not a good thing. When it comes to stress or anxiety, a lot of people turn to comfort food to deal with stress. Comfort foods are usually high in saturated fats, they're sugary, and they contain high amount of sodium. But what if we want to kind of just turn that around? What if we want to remedy that stress by taking maybe 5 to 10 minutes, a 5 to 10 minute walk, or meditate, inhale, exhale, just kind of step away from the kitchen. You can do that anywhere. It's free, and it can be done anywhere, you know, if you're feeling that stress or anxiety. Another question is, are you sleeping enough? I think during these stressful times, most of us are experiencing insomnia, or we're not really getting all the rest we should. Sleep and rest is a natural cycle of life. So restorative sleep is very crucial for a healthy immunity. Ideally, adults should get anywhere from 7 to 9 hours of sleep, and children need at least 10 to 14 hours of proper rest. So the message here is focus on balance. Body is smart. Listen to it. Thank you, and have a good evening.
Thank you very much, Nora, and also Marla. Thank you guys very much for your awesome presentation. And be safe, be careful out there. And now we're going to go ahead and turn the time over to Cody Chi, who is the fitness technician, and he'll be going over some exercises this evening with you all. Fitness for families. Cody, it's all yours.
Good evening, everyone. And my name is Cody Chi. I work here at the Winslow Indian Healthcare Center Wellness Center. And I'm the health and fitness specialist. And tonight, well, this evening, we'll go ahead and cover a quick exercise that you can do with your family in your household, in your backyard, or you can, just your immediate family. And so, just a really quick rundown of exercise. One of the key points when you're doing exercise is to do something that you enjoy. So if you like hiking, definitely hike, or if you like running, definitely run. Or if you don't like running, don't do running. Definitely you want to, the idea is to be consistent with your workouts. And so with this one, we'll go ahead and go through a warm-up, a workout, and then a cool down. So starting off with the warm-up, one thing that you got to keep in mind when you're doing a warm-up is to move around. So you definitely want to keep your body, you want to get your body to a certain temperature level, as well as your muscles. And when your muscles are warmed up, they do perform at a better workouts, and it helps to prevent strains or pulling your muscles, those types of things. So one good warm-up, even for your kids or yourselves, is a warm-up I like to call mingle. So the idea is to move around in an open area. So we'll just go ahead and start off with walking, and then from here you can incorporate some arm movements. So like, let's say you're doing an arm workout today, or shoulders, you can start moving your arms. Or let's say like today we're going to be doing some leg workouts, so you can do some hops, definitely get your lower body warmed up. And so, just keep moving. The idea is to continuously move and build up your body temperature and warm up your entire body. So that would be like a proper warm-up. And so now we can move on to workouts. I got 2 workouts for you. The first one would be head, shoulder, and toes. And so for this one, I'll go ahead and have Nora and Marla help me demonstrate. So you can use a pillow, you can use a remote, any type of object their kids are able to pick up. And so for this one, you want to definitely start in an athletic stance. So here, and then you're gonna give 3 cues. So either say head, so you're gonna touch your head. You can say either shoulders, you'll touch your shoulders, or toes. You can come down, touch your toes. And then there's one more, box. So whoever's first to grab the box, they're the winner of that round. So the winner will definitely, they can hang out. The one who didn't grab the box, you can do an exercise. So for this exercise, we can do shoulder taps. So we'll go ahead and come down into a plank position here. Yep. And then we're gonna go ahead and start touching our shoulders. So these ones, you can go back and forth. Okay, thank you. And so with this one, that's a really good shoulder, upper body workout. So then that would be 1 round. So the next round, we'll go ahead and go again, athletic stance. There you go. And then we're gonna go toes, touch your toes, and then we're gonna go box. And then the first one to grab the box. And so the idea is to, just a little bit of competition. And then you can add another workout for the person who didn't grab the box, like lunges. So we'll go lunges here. And start out, doing, different types of exercises. And so that would be head, shoulder, toes, and then you can put down any item. Okay, thank you guys. The next workout that I wanted to cover with you would be red light, green light, which is a classic game. And you can add workouts into it. So for this one, if you want to help your kids, practice their squats, building their lower legs, you can go green light. So green light, they would go at a normal pace. And you can say yellow light, and then they'll go slow. Or you can say red light, and then they have to hold it. And so this one, you can go for 30 seconds, and then you want to give them a break. And then you can move on to another exercise, like mountain climbers. So you can come down here into a plank position. Let's say you can start off with green light. So green light, you'll bring your knees up to your elbows, going back and forth. And then let's say you go yellow, then they'll go slower. And then red, they have to pause, hold it. And then again, you'll go for 30 seconds and then a break. That one you can go alternate them. You can do, like 4 or 5 rounds of red light, green light. And so that would be a pretty good workout for kids. And so that would finish up, or you can, and then on top of that, you can add some more workouts of your choosing. But those are just 2 that you can incorporate. That would be a lot more engaging for your kids at home. And then we'll go ahead and move on to a cool down. So with this one, you can go, these are kind of more in the tradition of your counting. So let's say you do a cool down where you're touching your toes. So this one, you'll come down and count to either 5 or 10 seconds, and then you'll definitely work on breathing, controlling your breathing. So here, 1, 2, 3, 4, 5, or you can go across the arm. 1, 2, 3, 4, 5. And at that point, you're just slowing down your body, slowing down your heart rate, and bringing yourself back into kind of a normal resting level of your body. Okay, so that's all I wanted to share with you guys. And so thank you for tuning in tonight. Okay.
Breaking a sweat. And so thank you guys so much for your exercises and your demonstration. And we thank you, Cody, for your wellness and health presentation. We appreciate that, and everyone needs that. So you guys take care, be safe, be careful out there. Again, we want to thank everyone for tuning in with us this evening, and all the presenters that presented this evening. Thank you so much for your time and your effort. And all of you, again, be safe, be careful out there, practice the CDC guidelines, because we all know COVID-19 has not gone away, and we still need to practice the CDC guidelines. And also, again, if you guys want to ask questions, make sure you go to schoolhealth@wic.org, or you can go to the survey box in the chat box. I'm sorry. Also, you can also go to the survey in the chat box. And again, this video is also being recorded. It will be shared on WIC YouTube channel and or our website. So thank you all again. Be safe, be careful, and we'll see you all at the next town hall meeting. Good night.